What if the U.S. decided to vaccinate the rest of the world against COVID-19? That's what more than 175 health experts proposed to President Biden in an August 10 letter sent to senior White House officials and shared with the Washington Post. "We urge you to act now," the letter reads. Announcing within the next 30 days an ambitious global vaccine manufacturing program is the only way to control this pandemic, protect the precious gains made to date, and build vaccine infrastructure for the future. The experts are asking the Biden administration to do three things. Only 24% of the world's 7.8 billion people have been fully vaccinated, according to figures compiled by Our World in Data, which gets its information from governments and health ministries. If the letter's proposal is adopted, 4 billion people, more than half the global population, could be fully vaccinated by the end of 2021 with U.S. manufactured doses. These are highly ambitious goals. But the signatories say they are necessary to curb rising infection rates as the Delta variant surges in Africa, Latin America and Asia, regions where vaccines are least available. These measures can also protect against emerging variants, some of which may be resistant to current vaccines. To better understand the letter's demands, we spoke with Dr. Paul Farmer, a Harvard Medical School professor and co-founder of the global health organization Partners in Health, who co-signed the letter alongside health academics, civil society leaders and others. This interview has been edited for length and clarity. Why did you and your colleagues decide to draft and send the letter? This is a group of global health folks with long experience responding to health crises in this country and in others. But this time, we have some new tools that are revolutionary. In sharp contrast to global plagues in the past, not even a year after identifying the pathogen, we have these highly effective vaccines, particularly mRNA vaccines. The COVAX goal of hitting 20% of the populations of low-income countries in the coming year is low. So, we thought, is there a way for us to spur into action what we see as a fairly supportive administration in Washington? Is it fair to single out the U.S. to shoulder the global burden of vaccinating against COVID-19? Why not ask other wealthy countries to chip in? It's not fair. We're cognizant that we're asking the U.S. to do more than any other country. But we have the vaccines and the technology to cover the vaccination gap for the whole world. So, it's a wonderful opportunity for us to say no to vaccine nationalism and yes to establishing a global standard of care for COVID and prevention of COVID. Also, most of the signatories of the letter are Americans. So, we're begging our own country to do more because we think it can and we think it should. Is this going to be an impossible challenge? It's not impossible.